Welcome back. The American Cancer Society says 12,000 new cases of invasive cervical cancer are diagnosed every year. That is a lot of women. While that number sounds scary, the good news is the early detection can help women fight the disease. Dr. Yvette Williams-Brown, who is from Seton Medical Center, joins us this morning to talk about how you can cut and lower your risk for cervical cancer. Thanks for joining us.
Thanks for having me.
Okay, so let's start from at the top, because you were saying that many times there are no symptoms.
That's true. For very early cases of cervical cancer, we may just find this based on an abnormal screening test, but for some women, they may have actual abnormal bleeding, or they may have pain during intercourse, or sometimes an abnormal discharge.
Now, is it, this is what, I don't know if this is a myth or if it's fact. I've heard this, so that once it gets to that point, it might be too late.
Not necessarily true. In some cases, it could just mean that we can see something that we can immediately start to treat, and that means we would biopsy this, and then that would start the treatment. And so not necessarily that it's too advanced and that we shouldn't treat, but I think at any stage there are treatment options.
Okay, let's start from the beginning. How is it caused?
So the most important cause is human papillomavirus. That's why it's extremely important for people that have children, especially girls and boys aged 11 to 12, to get the vaccine.
Okay. And then the other thing, too, is that recently there has, for some insurance companies, they've changed how often you get pap smears, which can help you diagnose or find out where it is. From what I understand, it's gone from 1 year to 5 years getting pap smears. Is that correct?
So the guidelines have changed a bit. For women starting at age 21, they can get the traditional pap smear done every 3 years.
3 years, okay.
And up to age 29. And then at age 30, there are a couple of options. They can continue to get that same pap smear every 3 years, or they can extend their screening by adding an additional HPV test to a pap smear. And new draft guidelines released will likely change that combined testing to every 5 years with just an HPV test.
Why was that changed? I mean, if we're seeing cervical cancer on the rise, shouldn't we get a pap smear at least once a year?
Well, the pap smear has been very effective since it was first introduced in the 1950s, and what we found is that because it is so effective, and also with the addition of HPV testing, we don't have to test so frequently. We can feel very reassured when we have negative tests within a 3-year period, or with a combined test every 5 years, that the chance of having actual cancer is extremely low.
I see. And then who should get the screening done?
So anyone, again, starting at age 21 up to about 65, unless your cervix has been removed, or if you have conditions that would then need additional screening beyond those normal guidelines.
Really quickly, the treatment for it, if you're diagnosed with it, what are your options?
Treatment typically involves surgery, may also involve radiation and chemo. That's why it's extremely important to try to catch it early so that you don't have to go through treatment.
Okay, and that's what we're telling women today is talk to your doctor about this. Talk to your family also, too.
Yes.
And catch this as soon as you possibly can, because that could save your fertility and your life.
Absolutely, and get your kids vaccinated so they don't have to worry about this at all.
Got it. All right. Thank you so much, Dr. Yvette Williams-Brown, for joining us.
Thanks for having me.
All right.